problem. Good afternoon and welcome to African Americans and COVID-19 Vaccines, a virtual town hall event in observance of Black History Month and the initiation of COVID-19 vaccines. On behalf of the Greater Cleveland congregations, we're glad that you've joined us and are excited about what you will leave here with in your toolbox. We have individuals from throughout the region and elsewhere here to add to our collective voices and consciousness to this important and ongoing conversation. Confronting a troubled history as it relates to the inequities of health, care, and flat-out abuses in African American in the past, equipping our community with the facts that will help guide our community in this critical moment in history. We already know that people of color and African Americans specifically have suffered devastating losses at the hands of this virus during this pandemic. So let's get our ears prepped for an empowering afternoon of understanding, of information, and of communication. So now I want to invite Pastor Micah Sims of the Lee Memorial Church to come and lead us with our prayer today. Pastor Sims.
Thank you, Dr. Quincy. Let us look to the Lord in prayer. Eternal and all-wise Heavenly Father, we thank you for this opportunity that you have granted us, your children, to gather in your name so that we might come collectively to be informed, to be empowered, and to become a collective unit as one, as we seek to provide healing, not only for people of color in Cleveland, but for our city, our state, our nation, and our world. We're praying right now, God, that you will bless those that are going to participate. We thank you for their individual callings to their various fields, whether it be medical, whether it be clergy, whether it be advocates and stakeholders. God, we come asking your blessings today. Give us discernment, give us wisdom, give us knowledge for the facing of this hour. God, we thank you for the healing that you have already provided. And God, we take this moment right here to pray that you would just cover and provide support and actually come and be a blessing to those that have lost loved ones, who have suffered mightily during this pandemic. We pray, God, for their healing and recovery right now in the name of Jesus. And God, we pray that in everything that we might say and do, that it would be to your glory and to benefit your kingdom. And we ask it all now in Jesus Christ's name, amen.
Thank you, Pastor Sims. About 1 year ago, the Greater Cleveland congregation family gathered at Olivet Institutional Baptist Church, over 1,100 strong, to celebrate our work, renew our commitment, and welcome others. What we didn't know at that moment is that in just mere days, we were mere days away from a catastrophic healthcare event in a generation, impacting all of the United States and indeed people around the world. As this pandemic began to ravage communities of color, we noticed its impact here locally and joined forces to do something about it. Thus, the Color and Health Initiative was born. With myself, Pastor Coleman, Pastor Maxwell, and Louise McKinley as co-chairs, and the rest of GCC as participants and partners, the Color Health Initiative worked to reduce inequities, provide services, and advocate for communities of color. We began by assessing the problem. We learned that African American communities of color and communities of color did not have adequate access to personal protective gear, testing, and other support. We have advocated for our community, pushing CVS, Rite Aid, Walgreens to provide more testing in the city of Cleveland and in their city communities across the country. We have worked to keep and to call out the accountability. That is, to keep ourselves accountable, our communities accountable, and our allies accountable to the continued work throughout the pandemic and beyond. We acted, joining with 17 Color of Health churches. We provided over 50,000 pieces of personal protective equipment, over 5,200 tests. And last week, we conducted a pop-up in which over 200 people were vaccinated. Our goal is to provide vaccinations to over 7,000 people through our local churches by July. Our next step is to have pop-ups at various churches. Later in this meeting, we'll announce our next 2 pop-ups, so stay tuned. We invited you here today to have a candid conversation about African Americans, the COVID-19 vaccine, and relationship. And so now let's get right into our town hall. We are honored to have as our first presenter this afternoon, Dr. Carla Harwell. She's an internal medicine doctor at the University Hospital Systems and will share in the context of African Americans and the COVID-19 vaccine. Dr. Harwell.
Hi, good afternoon, everyone. African Americans are dying at a rate nearly 4 times higher than the national average at 53% of deaths. When I walk the hallways of the hospital, looking in the rooms, looking in the ICU units, it's people of color that are greatly being impacted by COVID-19. And why is that? African Americans and Latinos already are disproportionately affected with a lot of conditions that make getting COVID-19 more deadlier for us. We have more diabetes, we have more hypertension, obesity, lung disease. All of these things come into play when it comes to contracting and surviving COVID-19. If you look at who the real essential workers are out here, it's people of color. Who are the ones that are driving the buses? Who are the ones that's working in the cafeterias? Who are the ones that are working in housekeeping? It's mostly people of color. And so you just have a deadly mix here. You got this perfect storm of being a person of color, already being disproportionately affected by certain comorbid conditions, and now you contract COVID-19. This is why we're seeing more deaths in people of color. For African Americans to only make up 13% of the national population, we carry a burden of 19% when we look at deaths. Very disproportionate. If we look at Caucasians, who make up over 60% of the US population, but their share of death is only 42%. So we're being vastly disproportionately affected by this disease. We are at a greater risk of dying from COVID-19, as I stated, because of these comorbid conditions. And so what we want to talk about today, we hope to be able to dispel some of the myths around the vaccines, some of the myths around COVID-19, if you have those. And we want to paint a picture where hopefully by the end of this session, we can convince you, we can plead to you, we can make you see the importance of getting this COVID-19 vaccine. Because right now, that's all we have to fight this deadly disease. And as I say all the time, I am more afraid of contracting COVID than I am of the vaccine. And there'll be others today to get into further details about that. And we understand that, you know, there's still some concern about how people of color historically have been treated in the past when it comes to vaccines and clinical trials. And we hope to be able to dispel some of those myths. But what I want you to take away from my segment right now is that we are dying from this disease, and we are dying disproportionately. And I'd like to see us do something about that. Thank you.
Thank you very much, Dr. Harwell. We really appreciate that. We are looking forward to continuing this conversation. At this time, I would like to bring the pastor of the Olivet Institutional Baptist Church of Cleveland, Ohio, the Reverend Dr. Jawanza Coleman. He'll come and he'll share a history of African Americans in public health. Dr. Coleman.
Thank you, my friend. And it's great to be with each and every one of you on this very, very important conversation that we are having in our community. You know, as we confront the crisis, as we confront the crisis currently taking place in our community, it happens as we confront the reality that systems and institutions of health, having played an important and pivotal role in ending this pandemic, they also have a long history of abuse as well as exploitation at the expense of Black bodies. There's a long history, and because of this, a deep mistrust that we must be aware of. From the history of abuse and exploitation, from what we all know as the Tuskegee experiment, where African-American men were infected with the syphilis virus and then allowed to go on with their lives, have families and children, creating a generational plague unbeknownst to them, but used for medical research. To Henrietta Lacks, whose body was used as genetic material, and in using it as genetic material, she was unable to benefit from the very same medical advances that her own genetic material in and of itself created breakthroughs for. To the forced sterilization of African-American women, to the use of and the exhuming of Black bodies as cadavers for decades by medical colleges and universities without the person's pre-death consent or the consent of their families. To the more recent indication of the disparities and the treatment of Black bodies, when we know that the unconscious bias of even physicians affects the outcomes for Black health. Black babies born to white doctors are 3 times more likely to die at childbirth than those born at the hands of Black doctors. To the disintegration of our mental health system, causing our jails and our prisons to become the de facto medical and mental health hospitals and institutions, reinforcing the suppressing of the mental health crisis in the Black community, which causes many to not acknowledge the mental health challenges that they are having, lest they be deemed crazy and not receiving the health and support and intervention that they need. We could look at the defunding of the public health departments in America. Local public health departments, their spending has been down 18% to 2010, since 2010. 38,000 state and local public health jobs eliminated since 2008's recession. And so the question becomes, how adequate and resourced are our public health institutions at this moment of this deadly crisis? And even as we begin to think about funding for crisis in the past and present funding for things impacting our community, we still see those same disparities. African Americans make up 13% of the United States population. Yet we represent 42% of the AIDS cases in 2018. Of the $200 million that was spent in philanthropic support for AIDS in America, only 4% of the total US HIV-related philanthropic funding was directly addressing African-American needs. 13% of the population, 42% of the AIDS cases, but only 4% of the directed dollars. Even with the Affordable Health Care Act, which was meant to create an expanded health safety net for Americans, African Americans' uninsured rate is nearly twice as high as our white counterparts. 1 out of 10 African Americans are uninsured. 41% of African Americans are enrolled in Medicaid or some other form of public insurance. But the only problem with that is that many states with Republican leadership and Republican governors have not expanded Medicaid under the Affordable Health Care Act. Because of this, most of these states are in the South. The care gap with the lack of Medicaid expansion is in the South. Most African Americans in this country live in the southern and southeastern part of the United States. And because of this lack of expansion of Medicaid, African Americans are disproportionately impacted and are left without access to health. African Americans spend nearly twice as much of their household income on healthcare premiums and out-of-pocket expenses than the national average. And we have seen how lack of care and inability to access insurance or being underinsured drives hundreds of thousands of people each year into bankruptcy. We recognize that this is not only a past reality, but this is a present reality, the ill treatment, the lack of equity, and the lack of true fairness and justice in terms of distribution and outcomes. And so we respect those who have some precaution and some concern because they are not simply rooted in a superstition, but they are rooted in historical facts and trends. And we honor that and we recognize that. And that's why we made this forum today possible. Even today, we've seen reporting coming out of the state of Ohio that in the state of Ohio and in Cuyahoga County, African-American vaccination is twice as low as that of whites in Cuyahoga County. This cannot end. This cannot remain. It must end. So we recognize that we have a history of injustice in this country, but the only way that we can turn this justice toward fairness is through information, through empowerment, and us deciding to take the health of ourselves and our family and our community into our own hands. Thank you.
Thank you so much, Pastor Coleman. We really appreciate that. As we continue to, as we continue to go through our panelists, we are pleased to have individuals with us today from the Union of Concerned Scientists who will share science on COVID-19 vaccine and the virus itself. Please, everyone, welcome Anita Desenka and Casey Coleman at this time. Anita and Casey.
Hi, everyone. I'm Anita Desenka, and I'm joined here by my colleague, Casey Coleman. I'm going to share my screen with everyone. Just give me a second. Okay, perfect. So I'd like to, so we're here to talk today about the COVID-19 vaccine and the science behind it. So we're repeating things that the Food and Drug Administration and the Centers for Disease Control and Prevention have stated, the science behind it. And we represent the Union of Concerned Scientists. This is a science advocacy group that's been going on 50 years plus. We're, our organization and us, we are in no way affiliated with pharma companies or the government. We don't get funded. So this is just us just trying to give you the best available scientific information. And so I'm Anita. I have a master's in public health from George Washington University, a master's in science from Drexel University. In addition to those degrees, I have 8.5 years of public health experience, including 2.5 years at the Union of Concerned Scientists. And I'm going to pass it to my colleague, Casey, to introduce herself and kick off the presentation.
Hi, everyone. As Anita said, I'm Casey Coleman, and I also have a master's in public health from George Washington University, and I've been with the Union of Concerned Scientists for a little over a year now. So we're going to start off, or we're going to be focusing on some of the most frequently asked questions that we get. So to start off, we just wanted to go over how vaccines work in general. So the very basic science is that vaccines work to introduce a harmful or part of a virus into your system. so that you are able to recognize it without experiencing the same severity of illness or any illness at all. And then your body will be able to build up defenses, and then you will be able to fight off the virus when you come into contact with that virus in real life. And so currently there are 3 different types of vaccines that are being worked on for COVID-19. The first of which introduces a harmless piece of the virus into your system, as I had mentioned previously, and this has been used with hepatitis B, whooping cough, and many other vaccines for decades. The second type uses a weakened live version of a different virus, and basically they insert some of the genetic material of COVID-19 into the body of that virus as a vessel to deliver it into your system, so your body can then recognize the genetic material of COVID-19 and then start to build defenses. And this is what's being used for Johnson & Johnson and the AstraZeneca vaccines. And the third type, and probably the one that we've heard the most about, are messenger RNA vaccines. And this uses a piece of genetic material that teaches our cells to make a protein to trigger an immune response inside our bodies. And this has been used for decades in research related to the flu, Zika, rabies, as well as cancer treatments. And this is the type of vaccine that both Pfizer and Moderna have developed. And just to reiterate, none of these vaccines can give you COVID-19, and none of them interact with your DNA.
Thanks, Casey. So do the vaccines work well? So we looked at the hard data between the Pfizer, Moderna, and the Johnson & Johnson vaccine. This is what the Food and Drug Administration is stating. What we found was that there is robust evidence that it is safe and effective. So some of the things differ between the 3 vaccines. For instance, Pfizer can work in 16 years and older, while Moderna and Johnson & Johnson are 18 years and older. Pfizer and Moderna both have 2 doses, while Johnson & Johnson has 1. They're all of them tested in about 30,000 to 44,000 people. And there's different levels of effectiveness, and we're going to go into that on the next slide. So, but fun fact, we do want to mention that one of the things that we found pretty inspiring is Dr. Corbett's work. So she was fundamental in creating the Moderna vaccine. She's a strong African-American woman, and I have to admit I've been inspired whenever I've been reading up about her and her work. So the Johnson & Johnson vaccine, so we want to give this into context because just as of yesterday, the FDA approved the vaccine. And here are some statistics that the FDA is reporting. So it's 100% effective at preventing death. It's 100% effective at preventing hospitalizations. It's very good, 85% effective at preventing the worst of the COVID symptoms. And it's 66% effective at preventing you from getting COVID-19. Now, this is a hard number to contextualize with the 95% effectiveness with Moderna and Pfizer. We understand that it's hard for us, me and Casey and other scientists to actually wrap this number around our heads. So I'm just kind of giving you that these trials are run in similar ways, but they oftentimes tend to be a little bit different. So it's a little bit hard to compare all these numbers with one another, but it is still a good number. And the reason why I'm saying that is the FDA, in June of last year, they stated, okay, how we need to create guidelines that are robust. This is a terrible, terrible, terrible illness, and we need to figure out the best way to think about making vaccines. And so they stated that in order to approve a vaccine, it would have to prevent disease or decrease disease severity in at least 50% of people. Why did they state that number? They probably are stating it because annual flu vaccines are 40 to 60% effective on average. So this means that every year there's an epidemic of flu, and every year they have a vaccine that's about 40 to 60% effective. And it does manage to slow or stop the epidemic. So that's to give some contextualization. The Johnson & Johnson one was also tested a little bit different in a different time period than Pfizer and Moderna. So there's these new COVID-19 strains, and I'll talk a little bit more about that in a later slide. Another thing to note is that Johnson & Johnson is a one-shot schedule, but there's a lot of research right now about a 2-shot schedule and boosters, which could increase the effectiveness of the vaccine. Now, are they safe? So all three vaccines have shown to be very safe. And again, the most robust clinical trials you can imagine with over 30,000 people. The side effects are similar between all three vaccines, which are injection site, pain, fatigue, headaches. This is similar to a flu vaccine. Some people don't feel any of these effects. Some people kind of feel kind of sucky for basically a few hours or a day or so. This was the case, at least with my mom and dad, when they were getting the Pfizer vaccine. They weren't feeling very good for a day or so, but next day they were fine. And Moderna and Pfizer currently tested if it was safe in children. They're currently carrying out research whether it's safe in children 12 years and older. Now, we've heard some beautiful commentary already from Dr. Harwell and Reverend Coleman on the long-standing inequities with racial injustice in this country. And so one of the questions to ask is, were the vaccines tested in all different types of groups of people? And they were. So the Pfizer, Moderna, and Johnson & Johnson vaccines were tested in all different types of groups of people, and they work equally safe across all age groups, genders, and racial and ethnic groups. I'll mention one thing that the FDA did find. They found that people who had two conditions, if they were over 60 years old, and if they happen to have like certain comorbidities like diabetes or obesity, the vaccine may work slightly less well. These results aren't confirmed yet. It will take more study on that, but we want to just be forthright and say that this was one thing the FDA did notice. In terms of racial and ethnic makeup, it was very, very important that to the government that these companies adhere to a strong policy of recruiting people of color into their studies. And just to get a look at African-American individuals, the Pfizer-Moderna groups both have about 3,000 to 4,000 people who are African-American. In fact, the Moderna study was actually quite literally stopped by the federal government for a while because they weren't recruiting enough people of color. They worked with academics who already had long-standing relationships with Black and Latino communities to recruit more people of color so that it was more representative of the racial breakdowns that you see across the US. So the Johnson & Johnson vaccine, interestingly enough, actually has recruited more people of color than their prior to, so around double. And for just to continue a few more stats, women and men were tested equally for all three. And people who are 65 and older were well represented, around 20%. People with underlying health conditions were well represented, around 22 to 46%. And this includes people with diabetes who had about 7 to 10% representation in the studies. Now the variants, so it's natural that viruses will change over time and these changes can lead to a new strain. But there's 3 strains that are pretty worrisome right now, which are the UK, Brazil, and South African ones. All 3 are shown to be more contagious. Now, the Johnson & Johnson one, unlike the other 2 vaccines, have been tested in very rigorous trials against the Brazil version and the South African version, and they've been found to be pretty effective, actually. This is showing that they could be a really valuable vaccine to stop some of the spread of these really, really bad strains that are quite worrisome, actually. There's also testing right now going on with all 3 vaccines about booster shots to kind of combat these strains. And I'll let Casey talk here.
Yeah, so as some of you may have heard, it is currently recommended that if you are vaccinated, but of course also if you are not vaccinated, that you should be wearing a mask and practicing social distancing. And we just wanted to reiterate that, especially with the new variants that are shown to be more contagious, that any mask is only as good as its fit and filtration. So you want to make sure that your mask has 2 to 3 layers, preferably 3 layers of fabric, and fits snugly to your face. So no gapping around the nose, around the sides of your face, or under your chin.
Thanks, Casey. And the other data point that we really want to bring up here are the vast inequities that are being shown right now with vaccine distribution. So this is a study by the Kaiser Family Foundation. And what they found was that not all states are reporting for the study, just FYI, it's 34 states. But this data is showing that white people are getting the vaccine way more than people of color. In particular, their rate is 3 times higher than people who, Latinx individuals, and 2 times higher than people who are Black and African American. So this is showing that major discrepancies are going around in just the actual administration of the vaccine. And that's absolutely horrid and should be changed. So that's our presentation, and we're happy to answer any questions at a later point. Thank you, guys.
Thank you so much. It is always good to hear from both you, Anita, and Casey. You always bring good information to us. To all of our panelists, you have been amazing. You've been amazing. And so before we go forward, I want to remind you that we are, if you have questions, you can put them either in our Q&A or in our chat, and we will send those questions to our panelists shortly, and we'll have an opportunity to hear from them as well and answers to your questions. We are running a bit ahead, so I wanted to just take a moment to give you a second to breathe. I know we're showing a lot of information. Hopefully you're getting a chance to take notes. And we have a great panelist coming up next, Dr. Sonia Haywood. She is the Associate Dean of Curriculum Integration and Associate Professor of Medicine at the Northeast Ohio Medical University. She's coming to do the hard work, but the good work of discussing the myths and misconceptions and bring some facts to us to dispel some of the misinformation that is being put out there. And so, Dr. Haywood, we welcome you this afternoon. God bless you. It's on you.
Good afternoon. Thank you for giving me the opportunity to speak with you today. Yeah, we are going to tell you the truth. There are a lot of myths and misconceptions out there about this vaccine. A lot of them are based on our fears. We are a community that fears the health professions on many levels. And as Pastor Coleman alluded to this, it is real. It is just as much a part of our history as all the other things we've known when we've seen institutions who have consistently in our past had difficulties in making sure that we were entitled to the same quality of care that everyone else receives. We've got some issues. But we have to be clear on one thing in our minds, that these issues should not put us in a position to evaluate the value of things that have the potential and strong potential, good evidence to save our lives. This is one time where we do need to separate out what we've experienced from what we're living in now. Just to give you a little bit of thought, I trained right in the middle of the HIV epidemic. And at that time, it was a huge issue. And I went back just a little while ago to look at how many people died in the height of that epidemic to now, through 2018. We lost 700,000 people in this country to HIV, despite knowing probably by the mid-90s how it was transmitted, what were your risks of getting it, and how behavior modification could possibly keep you safe. And now we're looking at, by June of this year, we're on track to lose 650,000 individuals. And the proportion of those individuals are going to be higher when they look like me and you, when they are brown and Black. Yeah, we've got to put these myths and these misconceptions to sleep right now. Because with HIV, I knew it was a modification of behavior. I knew I could do something. But right now I go out on the street and if I'm within 16 feet of you without a mask and you breathe, I could die. All you do is breathe on me. And that's where I get where we're sitting, but I want us to move a little past that because this is life and death. So are African-American people more genetically predisposed to getting sick if they take this vaccine? No. No. Our gene pool is not making a vaccine act any different in us than it does in any other America's DNA or any other person's DNA. Not in terms of getting sick. Now, we just heard that maybe it isn't as effective in individuals who have diabetes or have other chronic conditions. Yes, I get that, but that's because those individuals with those conditions are immune compromised and may not be able to have the same response that other people have. And being one that is immune compromised, I get that. But when they told me at UH I was going to get that vaccine the Saturday after the New Year, I was there early. Despite knowing I'm immune compromised and it may not give me everything I need. But that's not the case with all of us. So you get the vaccine, or the people in your home get it. If everybody in your home gets the vaccine, but you choose not to, am I safe from catching COVID from them? Well, this is where the science, we need to catch up a little bit for a couple of things. You get your first vaccination, your body still has to build up an immune response. You get your second, it still takes a couple of weeks for that to happen. You could be disposed at that point to COVID, and therefore you're a carrier. And we're still trying to figure out that if you are vaccinated and you have had the immune response, what being a carrier could mean. We know now you're probably not going to get sick, but can you pass it? The science is still working it out. But there's one thing for certain, you will be alive from it. At least 95% of you will, which says to me that 5% we have to worry about. But as the gentleman said in Hidden Figures, I like those numbers. I'm okay with that. Does the flu vaccine protect you against COVID-19? That's like saying, is insulin going to control your high blood pressure? No, it'll do a good job on your diabetes. But there are two different types of viruses, and they require two different types of vaccines in order for it to be effective. Is there a home remedy considered effective for preventing COVID-19? Garlic, ginger, turmeric, apple cider vinegar. Yes, there is one. Go make yourself a 3-ply mask and keep it on. It's actually, you can use it over and over again. That is the home remedy that we have. That prevents people from breathing on you and you breathing on other people until we can get this thing under control. Can a temperature change in the weather be make the virus less vulnerable? I can say there was some data out there about that early on, but what we're coming to realize now is it's not panning out. It's not panning out simply because we're finding in other climates that it's not changing anything. But what we do know is that when you are in different climates, you have the ability to be outside, which means you have social distancing. Please communicate about these myths and misconceptions. Ask us, we will tell you our opinions, our thoughts, give you the science behind it. But be very leery of what we are willing to spread at this point. Thank you.
Thank you, Dr. Harwell, for answering those critical questions that people are dealing with and people are asking all around our community, you know, in terms of would there be, are there any of the, relative to the effectiveness of the vaccines, do you expect there to be any change in our community as a result of these vaccines that are being shared with us?
That question.
Oh yeah, I'm throwing that question at you. Do you think that now having these vaccines that it will provide a particular change in our communities?
Yes, I do honestly believe that we're going to see a decrease in death in our community, a decrease in illness and illness severity if we partake in getting vaccinated. Yes, I actually do believe that. And again, it's just because one, even if you get infected, which the Moderna and the Pfizer show that there is a peak where you are less likely to be infected. The disease process will be less likely because your body will not be able to produce the virus the way it has before. It won't run rampant, and we can decrease your disease plateau. And if we do that, we also decrease the side effects that happen post-infection. Right now, we don't know what that virus is doing to your lungs. We don't know what it's doing to your heart. We've got so many cases out there where people are getting infected and things are moving post-infection and they're still dealing with residuals. So absolutely, absolutely. Again, I like the numbers.
Thank you. Thank you. I appreciate that. I know that we have Reverend Humphrey coming on. After Reverend Humphrey comes on, Pastor Mike is going to lead us through questions. We have a number of questions that have been placed in our chat. We have over 230 people gathering with us today, sharing with us today. And so again, thank you so much, Dr. Hayward. And thank you so much, all of the panelists who come before. And we'll get back to you because we have some questions for you. I promise you that. So we look forward to it. We are pleased to have the pastor of the Imani Church of Christ here with us today, Pastor Michelle Humphrey. She's going to come with a query of what is the impact on African Americans are not vaccinated, excuse me. And so Pastor Humphrey, you can take it from here.
Yes, thank you. Good afternoon, everyone, to all of our panelists and those who are joining with us. Well, of course, to be vaccinated is a personal choice. It is a personal decision that we all must make. And the reason why we're having this town hall is so that we may be informed and have all the facts. But what if I choose not to be vaccinated? What is the impact on our community? Well, first of all, there is an economic impact. A research at the University of California, Santa Cruz, and a report by the National Bureau of Economic Research found that 41% of Black-owned businesses, that's about 440,000 enterprises, have been shuttered by COVID-19, compared to just 17% of white-owned businesses. And if this pandemic continues and we choose not to be vaccinated, it will be a matter of time before many of these Black businesses will close for good. A major reason for this is due to the lack of coverage and relief for Black businesses during this pandemic. For instance, the government's Paycheck Protection Program was designed to help small businesses cover payroll and benefits for their employees, as well as pay rent or interest on mortgages. But 95% of Black-owned businesses, 91% of Latino-owned businesses had virtually no chance of receiving a loan. To qualify for a forgivable loan, businesses needed to have a relationship with the bank. And truth is, many Black-owned businesses don't have such a relationship, nor do they have the minimum number of employees that are required to qualify. And banks that do cater to the Black community, they were not included in the first round of funding. And of course, banks earned larger fees handling the larger loans. Understand that if we do not get a handle on this virus through vaccination, it will result, again, in many Black businesses unable to survive. Black businesses will not only continue to be impacted, but the Black worker will be impacted as well. There are three main groups of workers in the COVID-19 economy: those who have lost their jobs and face economic insecurity, those who are classified as essential workers and face health insecurity as a result, and those who are able to continue working from home, or at least from the safety of their homes. And unfortunately, Black workers are less likely to be found in that last group, those who are able to work from their home. If we are not vaccinated, the impact on the Black economy will be detrimental. The recession has hit women, it's hit minorities particularly hard. Black-owned businesses closing at twice the rate of their white counterparts. And so that leaves about an estimated 82,000 Black women in right now who have lost their jobs. And we know that in many households, the Black woman is the one who is the head of the household, who has the responsibility of taking care of the family. And as Black women lose jobs, that results in housing insecurity, and housing insecurity leads to housing instability. And then that has an impact on our children. According to the U.S. Treasury Secretary Janet Yellen, economic crisis has hit people of color harder and longer. And the current crisis caused by the coronavirus pandemic would have a lasting impact on Black Americans unless action is taken. And what is that action? It's getting vaccinated. It also has an impact. If we choose not to get vaccinated, it also has an impact, a religious impact. According to a Barna Group study, 1/3 of Black churchgoers, 35% are concerned for their church's long-term health. And they ought to be. For many African Americans, Sunday morning is their sacred time of worship, of prayer, and community. Sunday mornings are what empower us to face obstacles and challenges and to press our way through. But because of the coronavirus, many churches have been unable to gather for worship. Most churches in America have less than 150 members, and not gathering means that churches' finances are impacted. They're impacted because you may not know this, only 48% of churches have been able to accept donations electronically. About 1/3 of all congregations have no savings, according to the 2018-2019 National Congregation Study. And the longer this pandemic continues, there will be churches that will be forced to permanently shut their doors. Now we can say, oh, praise God for live streaming, but just 20% of churches have been able to stream their services, the study also found, making it more challenging to serve the community and to serve the faithful. That means that if you want to belong to a church or attend a worship service, you're going to have to go to the white church down the street, because they will be holding worship services because they are being vaccinated. We are not. So if we choose not to be vaccinated, attendance will be restricted. And for some churches, only live streaming will continue. Funerals will be restricted. Weddings will be restricted, so that we do not continue to spread the virus. There's also mental health impact should we decide not to be vaccinated. Although prior studies have suggested a resilience in mental health within the Black community, there is great need for access to mental health services. Even before COVID-19, Black Americans were 20% more likely to experience mental health issues. Yet Black patients are less likely than their white peers to use mental health services or resources such as therapy and counseling or psychiatric care. According to a 2018 survey by the Federal Substance Abuse and Mental Health Services Administration, 16% of African American adults reporting having a mental illness in the past year. 22.4% of that group resulted or reported a serious mental illness. And of the nearly 5 million African Americans with a mental illness, close to 70% have not received treatment. According to a Johns Hopkins School of Medicine study published in December 2020, suicides among Black people have doubled during COVID-19 lockdowns, have doubled during COVID-19 lockdowns, while suicides in white individuals were cut in half during the same period. We were not designed to be isolated and shut off from the community, but if we're not vaccinated, this will continue and our mental health will continue to diminish. And we are seeing the impact of this pandemic in our families. We can't visit our loved ones who are in nursing facilities. I have a brother with cerebral palsy who lives in a group home. I've been unable to see him for over a year. I have made a personal decision to be vaccinated so that I can have my brother home on the weekends and be able to see him on holidays and go visit. We're unable to visit family members in the hospital. This is the reality of this COVID-19. It will restrict, it will forever change our way of living if we are not vaccinated. We can go on and on with statistics, but the truth of the matter is, if we're not vaccinated, Black America will face dire consequences. We're dying at a higher rate of heart disease. We're dying at a higher rate of cancer. Must we die at a higher rate of COVID-19 because we choose not to be vaccinated? Thank you.
Thank you, Pastor Humphrey. I really appreciate that. You had me in the amen corner over here this afternoon. And to all of our panelists, Dr. Carla Harwell, who did a great job in opening us up, and Dr. Sonia Haywood, and Anita and Casey, who did a great job for us. Pastor Coleman and Pastor Humphrey, thank you all for presenting and sharing that powerful information. We are very adamant about making a difference in our community, and the Color of Health initiative is about making that difference. We have 18 churches that we work with in the Color of Health, and not all are GCC churches. They're churches in our community who care about the people in our community. And so we did a bunch of pop-up testing in the fall. We're going to continue to do testing where it's available, but we're moving into the area of having pop-up vaccinations. And so we just want you all to continue to stay close, stay at hand. I know there are a million questions. Pastor Micah is here with us. He's going to lead us through answering some of the questions that you put in the chat and some of the questions you put in our question and answer. So Pastor Micah, I am done for today. I'm going to pass it over to you, and then you can pitch it to Pastor Maxwell as we go forward.
Thank you, Dr. Quincy. And once again, thank you everybody for being on this town hall. There are so many questions that are coming in. And we want to remind you, you can put them in the chat because certainly we have all of our panelists there typing in responses. You can also put them in our Q&A, and I'm going to raise some of those questions for some of our panelists at this point in time right now. I'm going to pick on Dr. Haywood for a couple of minutes and ask her to come back on screen if she's available, because of course there are some serious medical questions, and we believe in turning over these questions to the right professionals. Let's see if I've got Dr. Haywood. There she is. Hey, Dr. Haywood, you doing all right?
I'm doing fine. Thank you for asking.
Good. We got to continually make sure that those that are in the health field are doing okay. It is nothing wrong with checking on your own personal doctor, nurses, people that are in the medical field, because right now this is a very tense time and we want to make sure that you're doing all right. So thank you for responding. I wasn't just asking for the sake of asking, I'm being sincere. We want to make sure you're all right.
Thank you. Yes, God is good. Things are good. Busy, but good.
Busy, but good. Let me fire off a couple of things. We've got a question here. An individual has shingles. They've been dealing with medication for now 7 days. And they want to know in the next couple of days, really by March 3rd, are they going to be able at that point to take the COVID vaccine?
And in this one, I'm going to ask Dr. Harwell to also weigh in. Shingles is because you've been exposed to another virus that was living in your cells for a little while. And because of just the way your body works, it decided to replicate. We do have some things that we have put in place for those individuals. One, you can't get a vaccination for COVID if you actually have received the shingles vaccine within a 3-week period. So what needs to happen in your case is this is where you're going to have to really sit down with your healthcare provider that knows your history, and we would have to track back and really look to see what you have been given in terms of your vaccinations in the past. When was your shingles outbreak, and make some real individualized suggestions. However, this is a time frame issue. It's a time frame issue. What do I mean? As soon as the time frame gets figured out, you will be on the list to get your vaccination, because this is not something that's going to prevent you long term. It may have some challenges in the short term, but it is definitely not going to prevent you from getting the vaccine, and it may not even prevent you from getting it next week.
If you have a compromised immune system, doctor, which of the vaccinations would you recommend?
It actually depends, because I think they're all going to have they're all going to be different for people that are immune compromised, like myself. All that means is that your body is not going to have the same level of reaction at the dose that it's given to you, both the first and the second time. It may take you a little bit longer. It may take you a little bit longer. I received the Moderna, which was part of the 2-dose. I may not even look like the person who got it on the same day as I got it because of my immune compromise. I'm not quite sure the science on what would happen with the 1-dose for people like us, but I think, again, that is where you have to communicate with your healthcare provider, because if you're truly immune compromised, there are people who are in the system that can provide you the best information on that. But I don't think that there is going to be an issue of what's being offered and what you will get.
If you were recently diagnosed with COVID, come down with COVID-19, should you get the shot? And how do you know you're not contagious after you were infected?
2 different questions. And Carla, I'm gonna have you weigh on this. 2 different questions. The first question on how long you stay contagious is based on your timing from when you had symptoms, based on your timing from being positive, and then there is a washout period that occurs. So that's the answer to the first question. And again, you have to do the math to figure that out. And the CDC, I believe, I don't know exactly what the timing is. I do tend to always look it up when I'm faced with that question, but you've got to determine your washout period. Now, from that point on, yes, if you have been infected, you definitely still need to get the vaccine, because we don't know how long your antibody response lasts after you have been infected with the virus. So we don't know how long your immune system is going to keep trying to develop immunity after you've been exposed. And
if I could just weigh in, that's exactly right, Sonia. Yeah. So, if you've completed your 10-day quarantine and you have no symptoms, you can get the COVID vaccine. So that is the new CDC recommendations, is that you complete the quarantine, which has now gone from 14 days to 10, but you also need to have no symptoms. So those 2 things, and then you're fine to get the vaccine. So absolutely right, Sonia.
Since I have both of you, let me ask this question, and I think this is a really great question. Is it advised for pregnant women to get the vaccine?
Mm-hmm. I'll weigh in on that one. Pregnant women initially were not included in the clinical trials, but there is a new trial out now by Pfizer that is specifically looking at pregnant women, and they hope to enroll about 4,000 pregnant women worldwide, not just here in the United States. But even though pregnant women were not included in these initial trials, it is still highly and strongly suggested that pregnant women get the vaccine. Pregnancy puts you in a whole different category, in terms of your immunocompetent state and the fact that, you're carrying, a child within you. And so it is highly recommended. Pregnant women are getting the vaccine, and that is the current recommendation for that. But studies are on the way for that specifically.
And Reverend Micah, if I could, I'm going to expand on another myth that's
Please.
associated with that there was, if I'm in child-rearing age groups, should I get the vaccine? Is this going to affect my fertility? Is it going to affect the fact that I want to get pregnant? Or will it impact the DNA, my DNA and the DNA of my eggs and my unborn child? No. And that is because you're getting a piece, in some cases, of a protein, or you're getting a template that tells your body to produce a response to a protein that is just a template, that you're making the template and your body's now producing a response. This template, this process is not going to affect your fertility. And that is a strong myth that is occurring among child-rearing age in our community. And Carla, you can weigh in if you like on this, but this is where, no. Matter of fact, again, this is life or death. It will not affect your fertility. It will not affect your unborn children that you are not pregnant with at this particular point.
Yeah. There's only one group of individuals who definitely 100% should not take the COVID-19 vaccine.
Please tell us who that is.
That is if you have had a serious allergic reaction to ingredients in the vaccine. And the ingredients are two things: polyethylene glycol and polysorbate. Now people are going to go, what is that?
I was going to ask you, and what is that?
How would I know? Right. How would I know? It's an additive. It's a filler. It's not what Dr. Sonia was just saying. That little piece of messenger RNA is not that component of the vaccine, but it's the filler. It's the filler that's, you can have that filler in, other vaccines, and then, you've had a reaction before and it's the filler. I know this is going to cause a lot of, please don't panic, because I don't want you running out trying to say, oh my God, do I have a, allergic reaction to that? But, it's, you wouldn't know that, you wouldn't know if that's a filler in, let's say, a vaccine you received before and you had an allergic reaction. But that's really the only group of individuals that right now is being told not to take that. But that's for any vaccine. Right. That's for any vaccine. So it's nothing different with COVID.
We probably have a ton of parents, grandparents, aunties, uncles on the line who want to hear about our children and about the vaccine. We've heard ages 16 and 18 and lower are okay. I want to talk to you two extraordinary physicians and medical professionals that have joined us. What should we be, and how should we be concerned about our young people as the older age folk in the house are getting vaccine, but yet our children aren't? Can you talk about that for a moment?
Right now, the studies are showing that I think it's our children 12 and older are in the studies now, and they are, it's becoming that they're going to be safe to get the vaccination. We are looking at studies in children who are younger, but we are doing this the same way I think we did with our adult population. This is where the science, this is how we work. We start first with our adults and we start backing up to our children into the population of our children. And normally we started that 12 and up, and that's where we're at right now. And the science is going to pick up to tell us about actually vaccinating our children 12 and under. So this is where we have to be a little patient for the science to catch up. There is data out there that suggests, and it's just a suggestion, that children are in some aspects less likely to have severe responses to this, more likely to be asymptomatic carriers. But for our community, for all communities, when you're talking about your children, that doesn't bring a whole lot of satisfaction. Those are the numbers that me and Carla and other people live with. What you need to know now is that we are doing everything we can to have the science catch up to make sure that our children are going to be safe with this vaccine. And we're moving quickly to make sure that we will know that sooner than later, because that is a priority.
One of the quickest terms flying right now around COVID-19 is boosters. Because of the various the new variants that are coming, we've heard a lot about booster shots, obviously in addition to vaccination. Dr. Haywood, do you want to speak to us about boosters, and do we need to begin to get our hearts and minds ready for the fact that there may be a need to take boosters to help deal with these new variants that are coming? I'll let you speak to it as a medical professional.
Yes, we might as well. If we want to stay alive, if we don't want to have somebody breathe on us with the Brazilian variant, and we don't have the same level of protection that the vaccine that we use has against that variant, absolutely. But you've got to remember, we take flu shots every year. We are used to having to compensate for the fact that viruses are smart. They want to stay alive. They're going to change up on us. They're going to do everything they can to make sure they can protect us and replicate. And it is up to us to say, okay, you know, in 2021, I got a good vaccine that worked for that time, but now it's out there replicating, it's partying, right? And in 2022, I'm gonna have to stop the party and get another type of vaccine. That is the way we look at boosters.
Thank you. I'm going to close here with the questions and answers for incredible doctors. Obviously, as a pastor, we are concerned about getting people back into houses of worship, getting people back, our kids back into school, all of that. Real easy question. Even after taking the vaccination, should we continue to wear masks? And if so, for how long?
Yes, we need to continue to wear masks. Simply for the reason that I just said, variants are out there now. This thing has ran us over. It's hit us hard. And we are working hard to catch up, but we're not ahead of it yet. So that's the first reason, because we know that that is the number one protector. That's what we have to work with, is to stop the spread. How long? There've been a lot of data out there. And I'll tell you, when you say how long, I look at what the average data talks about in America, and then I trickle down to my community. I get down to the brass tacks of what do I tell my parents? What do I tell my colleagues? What do I tell my friends? You know what? Because we're dying at such a higher proportion than others, because we're still trying to make sure that our percentages of vaccinations go up. I think it's like everything else. When everybody else sneezes, we get a cold. We are preventing a cold here. So you know what? Whatever is being said, we're going to have to do it longer, because the penetration in our community has been so severe.
Yeah.
So unfortunately, I don't have an answer, but I like the numbers. I think we will stay alive now. I think the vaccine's going to work. But Carla, unless you want to add to that.
Yeah, I would just say that, you know, I think masks are probably going to be a new norm for us. I think even beyond COVID, you know, I mean, there's been, right now, we should be at the peak of our flu season, and we're not seeing as much influenza as we normally do. Well, why is that? You know, I think it's because people are wearing masks, and I think people are social distancing. And I think even beyond COVID, I think people are still gonna feel some level of protection, you know, with wearing masks. So I wouldn't be surprised if this doesn't, you know, continue even somewhat even beyond COVID. You know, I think some people, not everyone doesn't like wearing a mask. You know, some people have become used to it. They see the benefits of it, and there's other benefits from it, even beyond COVID. Like I said, influenza, our cases are down. I don't think that's a coincidence. And so, you know, it'll be interesting. You know, I know we're all tired of this, but definitely right now, the science still says, as Dr. Sonia say, you still have to wear your mask. You still have to social distance.
Since you mentioned the science, let me go back real quick for Dr. Quincy. Let me go grab Anita. Anita, on masks, should we just keep masking up?
So is this question referring to after you get vaccinated, if masking, or just in general, right?
Either way, both. Let's go with both.
Yeah, well, masks have this probably, it seems like a superpower, honestly, against the virus. It is by far and away one of the most effective measure. Just literally having a barrier from having these viral particles kind of being breathed into your mouth and nose. Masks just provide that. And it's becoming so important that, you know, 2-3 layers are now being suggested for people, or to have like a medical grade mask, because they just work so well. And for vaccinated people right now, it's recommended to continue this, you know, just to kind of make sure that there's a strong possibility that the vaccinated people won't spread the virus, but it's not 100% certain. And also it's, you know, like, it's just going to be a thing for our society for a while. You know, like your person who's at the grocery store trying to check if people have masks won't know necessarily if you've been vaccinated. So.
Well, let me thank Dr. Haywood, Dr. Harwell, Anita. Thank you for jumping in on that last mask question. Dr. Quincy, we got a ton of questions, and again, our panelists are going to stay around and answer those questions. I'm excited, Dr. Quincy, about the mere fact that a lot of people are asking about distribution. And so with that, I know Reverend Maxwell's about to come on and do call to action, but we also I want to remind us, we're going to launch a poll here right on our webinar for people to answer. This is critical information. There you go. Our Color Health Town Hall poll is right before you. If you could be kind enough as you're watching the remainder of this webinar to answer those questions, that's critical information that we can give to the scientists, to the medical professionals, and to all of us that are part of a Color of Health, so we can formulate a plan to address making sure that we get everybody who can be and should be vaccinated against this, against COVID-19. So once again, doctors, thank you for doing it. Am I tossing back to you, Dr. Quincy?
Yeah, I'll take it. All right. I'm gonna take it real quickly. Pastor Maxwell is coming with a great announcement, an exciting announcement, as well as he'll be coming to us with some information about how we can get active. So while you're taking this poll, there's only 5 questions. Please take some time to answer those 5 questions and submit your polls so that we can get those votes in. Pastor Maxwell is coming at this time. Pastor Maxwell, there you are. He's got a great announcement, exciting announcement. We told you we have 2 pop-ups coming up for you. Pastor Maxwell, tell them all about it.
We are very excited to announce 2 pop-up vaccinations. This Friday, the 5th, we have a pop-up at Affinity Missionary Baptist Church, 4411 East 175th Street in Cleveland. Registration for that pop-up will be open Monday afternoon, but we ask you, don't wait. Call the church now at 216-283-4365 and leave your contact information. So as soon as that registration link is up from government officials, we can get it to you. Or you can email us at affinitymail@affinitymbc.org. That's affinitymbc, as in Missionary Baptist Church.org. That's this Friday, the 5th. Now, we are also very excited to announce that on this Saturday, March 6th, our second pop-up will be at Olivet Institutional Baptist Church, 8712 Quincy Avenue, Cleveland, Ohio, 44106. You can click link right now to the centersohio.org/Olivet for registration. Let me say that again, thecentersohio.org/Olivet. Now, both of these information for both of these should be in our chat section. And so you can go in and you can get that information. We have flyers for both, but we are excited to announce this. So please make note of it. If you are 65 or older and have not been vaccinated, please take advantage of these opportunities. As you're continuing to fill out our poll, I want to just say to you that the continuing question that stands before us as an African-American community, whatever opportunity or challenge we are facing as a community, the question that continues to face us over and over again is, where do we go from here? And when it comes to this particular challenge of the COVID-19 virus and pandemic, it is both an individual and a collective question. This pandemic remains an evolving situation, with new variants on the rise and new vaccines continuing to come online, with new treatments on the horizon. So the first challenge we want to make to you, the first call to action we want to give to you, is that while we've armed ourselves with information today, please continue to arm yourself with information, with facts. Make yourself available to programs like this one that give us hard facts to go on. Make sure you're listening to the best science and to the best public policy as we move forward. Please continue as an individual to move forward with information. But information isn't worth anything if we don't use it. So it is our hope that the information shared today, and we'll see some of that in our poll, hopefully, but it is our hope that the information shared today will move you to get vaccinated. We've given you opportunities this weekend. We hope you'll take advantage of it. If you have not yet been registered or been vaccinated, if you haven't, please make a commitment to do so. You've heard the impact of these personal decisions on our families, on our own health, on the health of our communities, and the household, churches, and businesses within those communities. So once again, if you're 65 or older and you haven't been vaccinated, please add your name to the opportunities this weekend, Friday at Affinity Missionary Baptist Church and Saturday at Olivet Institutional. Collectively, we're asking you to commit to joining with the churches of the Greater Cleveland Congregation's Color of Health Initiative to end racial disparities in the COVID-19 infections and vaccinations in Cuyahoga County. How can you do this? If your church is not a member of Greater Cleveland Congregations, I hope you'll first make an effort for your church to join. If you're not the person to lead that decision, then go to your pastor, go to your officers, tell them about the work we are doing and encourage them to lead your church to joining Greater Cleveland Congregations. We're not only doing work in this area, we're doing work in so many important areas, and we hope you'll join us. But regardless of whether your church joins Greater Cleveland Congregations or not, join with us in this effort. First, by offering our church buildings as testing sites and vaccination sites. You can go to your leadership and make that effort. If you're a pastor and you're online, please reach out to us. If you do not know how to make those connections, we want to help. Secondly, by joining with us to advocate for our communities to receive federal, state, locally allocated resources to rebuild communities and neighborhoods that have been most severely impacted by the COVID-19 pandemic. Thirdly, by making yourself available to join with us in mass action. Join Greater Cleveland Congregation's mailing list by emailing us at info@greaterclevelandcongregations.org and emphasize that you would like information regarding the Color of Health Initiative or COVID-19 vaccinations. We'll get back with you and we'll make sure you're on that mailing list. Stay connected with us through our website. Be ready to make phone calls or to send emails to public officials. You can unite with us. What it takes to make change in the world is people united and money united. It takes people working together and putting their money together to put pressure in the areas where we need to do it. Please be ready to join with us. Together, let's go from here to healing. Together, let's go from here to reopening. Together, let's go from here to stronger, healthier communities. Thank you for joining us today, and thank you for joining with us as we move forward from this day. Keisha, do we have some results from that survey?
Yes, we do. Let me see if I can, share my, well, anyway, I can't share my screen. So the two interesting questions. If you, here we go. Right. If you attended this town hall, will you be willing to receive the COVID-19 vaccine? So 129 people, 88% said yes.
Awesome.
Only 3% said no. 12% were undecided, or 8% were undecided. And will you encourage others within your family, friends, and neighbors to receive the COVID-19 vaccine? 131 people, 90% said yes.
Amen.
So I will share the results. You should all be able to see it. All right, Reverend Maxwell.
I like those numbers, and as the doctor has said, and we want to continue to make them higher. Thank you for joining with us today, and we're going to move forward now with our closing litany.
Good afternoon, everyone. My name is Reverend Dr. Lisa Goods. I am the senior pastor of Shiloh Baptist Church. I'm new here to the city of Cleveland, the new pastor of Shiloh, and glad to be working with GCC, all of these pastors, scientists, and doctors on this effort to protect our community. Before we close out and go into our litany, I just wanted to share a few words with you out of my own personal experience. Last year, prior to coming to Cleveland, I had the privilege of spending a year as chaplain at Christiana Care Hospital in Newark, Delaware, the only level 1 trauma center on the East Coast between Philadelphia and Baltimore. Once the pandemic hit, as a chaplain, my primary responsibility transitioned into ministering to those affected by the coronavirus, those who were hospitalized, on ventilators, and many times dying alone due to the necessary restrictions of COVID-19. I ministered to families on the phone, to husbands, wives, daughters, sons who were scared because they could not be there with their parents, who were facing life and death, who were being placed on ventilators. I ministered to people who were distraught, not being able to be there for their loved ones as they traverse this disease. And at the beginning, I wore PPE and held the hands of patients and prayed as they expressed their fears and thoughts of dying. Later, we had to use video technology and minister to people through iPads and through the windows of their room doors. I performed rituals over bodies of people whose families knew that they could not have funerals because COVID protocols had prevented those, or funeral homes were just so overloaded that they could not have a service. And I noticed even before it was announced that it was primarily Black and brown bodies that were being taken out by this virus. But I will never forget the cries of my first patient, an African-American woman, 52 years of age, younger than I was. She cried out to God in such agony that it was palpable. She cried out for help, and her cries chilled me to the core. And as she shared with me, she shared that she had lupus. She had been sick all of her life and was accustomed to pain, but she had never felt anything like this virus. I can still hear her cries. I can still hear the fear in the voices of my patients. I can still see the bodies on ventilators and the bodies that did not make it. I still hear her cry ringing in my ears. And my concern for the future of each of us and our community is that we would not continue to experience this. And so I ask you to keep her voice ringing in your ear. Keep the cries of those who have died and those who have lost loved ones ringing in your ear as you join me in this litany of commitment. The litany will appear on your screen, and I will read the leader, and we ask that each of you read from where you are, the people, as we commit together for our collective health, the health of our community, and the health of each and every one of us. We gather today on this final day of Black History Month, honoring our ancestors, recognizing their struggle, and resolute not to let the stories be silent. We hear the words of James Weldon Johnson and remember that we have come over ways that with tears has been watered. We have come treading the path of the blood of the slaughtered.
If it
had not been
for the Lord who was on our side.
As we gather, we understand the ways that racism, disenfranchisement, and our history of exploitation has sown seeds of distrust, anxiety, and mental anguish in our minds and in our community.
If
it had not been
for the Lord who was on our side.
Yet, as we gather, we recognize the gravity of our present situation. We recognize that COVID-19 is ravaging our communities, taking the lives of our sisters and brothers, mothers and fathers, elders, neighbors, leaders, and friends, many dying alone. We remember families who mourn, left without the comfort of our cultural end-of-life traditions, or even a hug of condolence from a friend.
We honor the
lives of those lost to this insidious virus who now live among the ancestors. And we pray for those left mourn their loss.
Today, we realize that by continuing to live in fear and distrust of science and our medical community, we allow the demonic forces of systemic racism to continue to kill Black bodies, this time on the lynching tree of COVID-19. And we remember as people of faith that God has not given us the spirit of fear, but of power, love, and a sound mind.
We will walk by faith and not by sight.
Using the power of that sound mind, we recognize that God has anointed, gifted scientists, doctors, nurses, and other medical professionals for such a time as this. And we understand that through the vaccine, you have provided a balm in Gilead to heal this disease.
We commit to
science.
We recognize that you have called us to love our neighbor as ourselves and to be our sisters and brothers' keepers. In this, we acknowledge that being vaccinated, wearing our mask, and remaining socially distant is an act of godly love.
Commit
We
to
commit to being vaccinated.
We
We
commit to
commit to
wearing our
wearing our
masks
masks
properly
properly,
and following
following
safety
safety
protocols
protocols.
as an act of love.
Finally, we remember your words that our bodies are your temple. So we commit to caring for our bodies through regular doctor visits, getting the recommended screenings, and striving for a healthy lifestyle. We praise
Praise
you,
you,
God,
God,
our
mind,
mind, our soul, and our body. Stand
and
up
up
in us
as we strive to honor this commitment and
faithfulness in love
in
and
love
by your power.
and by your power.
Amen
And
and
Amen
ashe.
and ashe. We want to thank our panelists, Dr. Haywood, Dr. Harwell, Ms. Desikin, Ms. Coleman. We thank each of you for taking your time, each of you who have participated in this discussion, for taking the time to join us in this virtual town hall. We hope that what you have heard will not only empower you to move forward with the vaccine for your own health, but that you will pass what you have learned on to others. And so as we leave on the closing screen, you will see the information again on how to follow up with us, the information on the pop-up vaccines, and information on how to get connected with GCC. So as we leave this place, may the Lord bless you and keep you. May the Lord make God's face to shine upon you